This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. If you have questions or topic suggestions, you can call us at 248-651-5010.
Hello and welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones. And each and every week, we bring information to you that's valuable and very necessary as we age. And this week, our topic is medication management. And it's because there are so many issues. We are diving into the critical topic of medication management for aging adults. Because as our loved ones grow older, managing medications becomes more complex. Finding ways to simplify and ensure safety can bring peace of mind to both the individual and their family. And nearly 90% of older adults age 65 and older take at least one prescription medication, and over half of those take over 4 medications. And the source of that is the Kaiser Family Foundation. So lots of pills and lots to keep track of. And even with the best of intentions, you can lead to missed doses, mix-ups, worse or harmful drug interactions or contraindications. So because of my background in pharmacy, I am a very strong advocate of doing the right thing by medications.
Absolutely, Wendy. So to segue, the importance of medication management is such a big topic that we have to spend a little bit of time on.
Mm-hmm.
Effective medication management really is vital to keeping aging adults healthy and safe. When medications are not taken correctly, the risks of serious health injuries, such as hospitalizations, worsens conditions, rise significantly.
I got to tell you a quick story, Erica. You're not even going to believe this. I had a gentleman whose wife was on 15 meds, a day. And instead of giving them morning, noon, and night, he decided he was going to make it easier on himself. And when she was done with her cereal every morning, he would dump all 15 meds into the milk. And she would drink those meds every morning at the same time. Of course, the meds got in her. Not the right way to do it.
No, that can cause so much toxicity.
Frightful. That poor body, that poor woman's stomach. I mean, this is not how to do medications.
Absolutely not. There's a reason why the doctor says 3 times a day. It takes your body on average 7 to 8 hours for those 3 times to absorb the medication, get it in your bloodstream without causing any additional complications like a heart attack or a kidney that's no longer functioning and going into kidney disease because of the way that we're taking our medications. It's just so important. For our seniors, the challenges are really numerous. Memory issues, complex medication schedules, and polypharmacy, which is taking a lot of medications, multiple meds, are common obstacles. Many of the individuals find it hard to remember whether they've taken medications or they forgot to reorder medications on time, leading to missed doses or dangerous overdoses. There's a lot of real life scenarios that are all too common. Somebody forgetting to take their heart medication and then they doubled up, or they forgot to take them and they didn't go to the pharmacy, and then months go by and they got into the routine of not taking that medication.
And then they almost forget. Right.
Heart disease worsens because of that.
Mm-hmm.
I also have a story about medication management, is that we had a gentleman who wasn't listening to the pharmacist. He wasn't listening to his wife. He wasn't listening to the doctor. And the doctor says, your wife can't have Tylenol. And instead of listening to the doctor and not telling the pharmacist, more medications were prescribed while he was giving his wife Tylenol, as well as all the prescription pharmacy. And she ended up with kidney disease and on dialysis because of the way that the medication management happened. And I know that we all dose ourselves because we know what's wrong with us and we know that it's a little bit of ache and pain.
Right.
But especially for your aging
That's
adult,
devastating.
collaborating with your pharmacist and your pharmacy about what over-the-counter medications look like, as well as what has been prescribed, are just so important.
So one of the things I highly recommend is, and nobody thinks of this, but I'm just going to be honest, your pharmacy, your CVS, your whatever pharmacy you go to, Walgreens, Costco, it doesn't even matter. There is a consultation. Everybody sees it on the side where it says consultation, free consultation. All you got to do, put all your meds in a bag, walk up to that line, stand there and say, "Can I speak to a pharmacist?" I highly recommend having them written down with the doses next to them, but bring the pills with you also. 9 times out of 10, when I have told patients and clients this, they go to that situation, they sit down with the pharmacist, and it takes a pharmacist not even 5 minutes, probably 3 minutes. They can look at those meds off the top of their head. They know if there's a contraindication. They know if there's a side effect. If they're like, which one of these could be causing migraines, whatever it is, right? They know right away. They are trained professionals that have been through years of schooling. So I just want to encourage you, any side effects you have, don't just accept it. Ask a pharmacist. They are the experts when it comes to medications.
Well, another thing that a lot of people don't realize is that when you go to the pharmacy, you can ask them to have a printout of your current medications as you take new prescriptions in. And you can ask that pharmacist to take a look at your current medications, make sure that there's no contraindications, that they're going to cancel each other out or they're not going to be effective. But then you have an updated list. There's also something else that you can consult your pharmacist for, which is a medication administration record. It's a sheet of paper and it says morning, noon, night, or whatever times that you should be taking those medications. And it is such an easy tool to set next to the medications. And you can go ahead and you check off every time you take that med, you take the medication, you take your 4 ounces of water, and you go ahead and check off or do your initials. So you have that medication administration record in front of you.
And I think what people don't realize too is there are dispensing systems. You can actually order them on Amazon if you type in medication management dispensing system, because a lot of families are driving over to the house, putting all the little meds in the little pill boxes every week, and they're exhausted. And there is an easier way to do this. You do not have to drive over there and do that every week. You can purchase a medication system for 30 days.
You also can go to the pharmacy and ask for them to see if they can put them in a blister pack per day. They call it a diskette when you're looking at the pharmacy world, but this little cassette or diskette that has all of the medications are labeled 1 through 31, and the pills for that day are labeled and what time on the corner when you should take them, which is also another great way. There's some online pharmacies that do all of your medications for the morning in a small pill pack, and then all the afternoons, all the evenings, and then any one-offs have their own specific time. So all you have to do is pull the packet off the roll and go ahead and use the perforated line.
It just eliminates all the guesswork and it helps you track, and you'll know exactly when your loved one is taking their meds. Huge peace of mind. And I highly, highly recommend it. And so many people aren't thinking of it. Yep.
Well, and nobody's thinking of it, and we're not thinking about delivery from our pharmacies. I got a text message yesterday for a prescription from me being to the doctor, and I clicked on the link to see how much my copay was, and I could deliver it for free to my address because of the type of medication it was with my local pharmacy. It's so important to go ahead and take a look at your medications, but we also need to know and recognize that poor medication adherence leads to nearly 125,000 deaths each year in the United States. The National Council on Patient Information and Education provided that information, and we have to work together with our healthcare providers. It's a crucial step to prevent these tragic outcomes.
Yes, you do not want to end up in the hospital because you took too much medication or not enough medication. And it's very common, unfortunately.
So a great way to make sure that you're working together and you're utilizing the technology that we have available to us today is by achieving that peace of mind. And if you go to any doctor's office, don't be afraid to go in and talk to your pharmacist and say, "Hey, can I have a printout of all the medications that I'm on?" They'll be able to print that out. You can go on Walgreens and CVS's website and print that out as well. Any medications that was sent, that was filled, you can find that on your online profile and print those out. And when you get new medications, take your old list with your new medication to the pharmacist.
Yes.
But also make sure you're taking any new prescriptions that might not be on that list to every doctor's office.
I'm so glad you said that, because I was just going to say your PCP, your primary care physician, is technically the gatekeeper Okay, so you have, let's say, 3 different doctors. A lot of people have a cardiologist. A lot of people have different physicians that they see for different diagnosis. And what's important is they usually say, and even after you visit a hospital, follow up with your primary care physician within 7 days. And the reason they say that is because all these different doctors are prescribing different medications, but the primary care physician is the gatekeeper. They've got all the information in one, and they can look at it and say, oh, this is good, this is good, this is good, or wait, we got to look at this. Let me call your cardiologist and see if we can change this med. So it is so important. Your primary care physician is the gatekeeper. And if you don't have a primary care physician, this is a plug, you should have one. You should have a person who knows you, who knows everything about you, who does your blood work, who does your physical. This information is critical. You need to have a great partnership with your primary care physician and your pharmacist.
Absolutely. Your pharmacist is your ref, and your primary care physician is your coordinator.
Love it.
You need to make sure that they're working together to keep you safe.
This is a time in life not to be fearful, but to embrace it and to move forward with knowledge and wisdom. And this is why we're sharing this vital information with you about medications. Thank you, Erica, for being with me today. Thank you, listeners, for tuning into Next Steps for Seniors, Conversations on Aging.